welcome to our Wellness Wednesday webinar. And today, we will be talking about girls and their nature. So, as far as I can observe, we have a lot of women right now experiencing this kind of challenges. And as you can see on the screen, it will be discussing, or it will be related to those pictures that you are seeing right now. So our topic for today is Polycystic Ovarian Syndrome. And supposedly we have a guest speaker. However, she has an emergency, or she has a medical emergency. So right now, I'll be taking over for the topic that you will be discussing. So what is Polycystic Ovarian Syndrome? So polycystic ovarian syndrome is a condition that affects a woman's hormone levels, in which it produces higher than normal amount of male hormones. So later, I will be discussing what are those male hormones. And then this hormone imbalance causes to skip menstrual periods and makes it harder for them to get pregnant. So this is the ovary. So if we will enlarge it, or if we will see the big picture, so this is the uterus. So ito yung ovary natin. So inside the ovary, merong cyst. And then this is the polycystic ovary, and this one is the normal. So ganyan yung normal physical appearance of the ovary. Ayan siya. So ganyan yung nasa loob ng mattress natin. So what are the causes of PCOS? So number one, genetic, of course. Malaki talaga yung contribution niya sa causes. And then stress. Insulin resistance. So there's a tendency na mataas yung sugar level natin, or blood glucose. And then hormonal imbalance. So most likely, pag yung hormones natin is above the normal, meron talagang mga effect din yun sa katawan natin. And of course, lifestyle. So what are the risks? So as what I mentioned earlier, genetic talaga yung number one. So if your mother has PCOS and your sister has it, so most likely meron ka din. And then if you have also an insulin resistance or obese, then magkakaroon ka din yan. So what are the symptoms? So number one, trouble conceiving or infertility. I will explain later why. And then mood changes, of course, yung mood swings, grabe. And then acne, and then fatigue, insulin resistance, high testosterone levels, which is the male hormone, and then male pattern baldness or thinning of hair, and then irregular or missed periods, and then low sex drive, and then ovarian cyst, and then weight changes and trouble losing weight, and excessive body hair growth. So of course, guys, I want you to remember that I am not a doctor. So if you will encounter this kind of symptoms, the best person that will assist you, or the best person that will diagnose you, is an OB-GYN. So you can consult them with your symptoms that you're experiencing. So signs of a hormonal imbalance. So number one, irregular periods. So periods are irregular or absent, or amenorrhea in medical term. Sometimes period occurs only after taking medicine. So this is due to hormonal imbalance and ovulation, egg not released from ovary. So walang ovulation na nangyayari, or walang release ng egg cell from your ovary. So weight gain, rapid increase in weight, increase in fat, especially around abdomen or the tummy area. And then difficulty in losing weight even after dieting and exercise. This is due to insulin resistance and increased androgen hormones. So kung nahihirapan kang mag-lose weight, and then meron kang napapansing kahit nagda-diet ka na and then nagwi-weight gain ka pa rin. So there might be other reason why hindi mo na-reach yung desired weight mo. And then infertility, so difficulty in getting pregnant due to failure or of ovulation. So egg not released from ovary. So hindi ka mabubuntis kasi walang egg cell na lumalabas. And then psychological issues such as sadness, grief, anger, to more severe symptoms like depression and anxiety. So mood swings, kasama na dyan. So minsan yung sarili mo, hindi mo na siya naiintindihan. So minsan iiyak ka na lang, minsan grabe yung yung galit mo. So mixed emotion siya, which is it will also it entails the hormonal imbalance. So signs of excess androgen hormone or the male type hormone. So as what I mentioned earlier, ito yung acne or pimples. Magkakaroon ka ng malalaking acne. Hindi siya yung acne lang na nakikita natin na parang normal. If you find your acne or pimples na hindi talaga siya normal, then you have to consult. So hirsutism, excessive hair growth or on the face, chest, and back. So, madaming hair. Hindi lang siya basta-bastang balbon ka lang kung tingnan. Pero if hindi ka naman talaga balbon and then nagkaroon ka ng mga hair growth on the parts of your face, chest, back. So, isa din yun siya sa symptoms. And then thinning hair or hair loss. So, hindi lang stress yung reason kung bakit nag-hair loss tayo. Could be, meron din tayong PCOS, especially sa girls. So diagnosis of PCOS, how the doctors diagnose the PCOS. So anovulation, which means your ovaries don't regularly release eggs from ovary. So there will be irregular or no periods at all. So magkakaroon ka lang ng periods ng pag nagtitake ka ng medicines or minsan after 2 months, after 3 months. And then this can be confirmed by serial sonography or ultrasound. Makikita din yan. So excess androgen. So of course, yung hormones natin nasa blood level siya or nakahalo siya sa blood. So magkakaroon ng blood test. So makikita yan siya every second or third day na menstrual cycle to confirm the diagnosis. So polycystic ovaries, your ovaries become enlarged and contain many fluid-filled sacs or follicles which surrounds the egg. So ayan, yan yung tinatawag na cyst. So either nasa loob siya ng ovary or nasa labas siya ng ovary. So sonography or the ultrasound or any imaging devices. So makikita yan siya na the ovary contains a large number of harmless follicles or cysts. So ang size niya is up to 8 millimeters. So medyo malaki na din yun. The follicles are underdeveloped fluid sacs in which eggs develop. So dun siya pumapasok or dun siya nakalagay kung saan magde-develop yung mga egg cells natin. So what are the pregnancy complications? Of course, pag PCOS ka, number 1, miscarriage talaga yon kasi nga hindi fully develop yung ovaries natin. And then high blood pressure, and then gestational diabetes kapag nagbuntis talaga tayo. So kailangan talaga nating maging careful when it comes to being a pregnant woman and before tayo magiging pregnant. So meron talaga siya mga preparations, specific examination in order for us to be a healthy pregnant woman. So what is the normal menstrual cycle? So 28 days talaga ang normal. So from 1 to 7, that's your menstruation. Minsan nga 5 days lang tapos na yung menstruation ng babae. So meron tayong tinatawag na follicle phase. So your uterus lining thickens again. So ibig sabihin nagko-compensate yung mattress natin or yung uterus natin kasi pag nag-menstruate tayo, magfo-fall off yung uterine lining, so magiging manipis. So pag nag-follicle phase tayo, kakapal siya ulit kasi magkakaroon na ng ovulation. So yung egg cell kasi, pag nag-travel yan outside the ovary or from the ovary, papunta sa fallopian tube, papunta sa uterus. So, pag nagkaroon ng sexual intercourse between a male and a female, magmi-meet sila dun sa gitna. And then, pag yung egg cell na may sperm cell or may nag-conceive na or may conception na nangyayari, mag-i-implant siya sa wall ng uterus natin. So that's why yung uterus ng babae is nagpe-prepare siya for the pregnancy. Now, if wala namang sexual intercourse nangyayari, so magkakaroon pa rin yan ng thickening of the lining up to 28 days yon. So on the 20th day, on the 29th, magfo-fall off na yung uterus lining natin. That's why we do have menstrual cycle. So mag-shed off na yung mga ano natin, lining. So merong iba dyan napapansin natin during the menstruation, merong mga konting laman-laman. So that's our uterus lining. Kasi nga, kailangan niya mag-fall off para yung ano natin, yung uterus natin, magiging ready din naman siya on the next cycle for the pregnancy. So what happens during the menstrual cycle kung may PCOS ka? So ang nangyayari is, sa normal cycle, ayan. So on the 14th day, yun yung ovulation natin. So yun yung lumalabas ang egg cells natin. Now, when it comes to PCOS, wala talaga siyang nangyayaring ovulation. So straight lang yung hormones natin. So wala siyang egg cell. And then kung makikita nyo, para siyang necklace of pearls. So nakaikot lang yung, naka-arrange siya. Kasi umiikot-ikot lang yung egg cell natin, so hindi siya nilalabas ng ovary natin due to the cyst na meron tayo dyan sa loob. So hindi siya nalalabas. So management for PCOS, of course, since I am not a doctor, so ang pwede nating magawa or pwede nating mabigay na tips is how we will manage PCOS. So of course, as what you can see earlier na yung isa sa mga symptoms is weight gain. So in order for us to maintain or to normalize our menstruation period, so kailangan talaga natin mag-lose weight. So of course, I know some of you here familiar sa body mass index. So yung iba dyan nagpa-PAP or medical, nagkakaroon tayo ng merong table na tinitingnan si doc in order for us to know if obese ba tayo, overweight ba tayo, ganon. So may level 1, level 2, may mga levels pa yan yung obesity. So when it comes to management, of course, we have to control our eating lifestyle or our weight or the fats that we have sa body. And the next is stress reduction. So hindi talaga siya pwede nating matanggal kasi there's no such thing as stress-free kasi habang buhay pa tayo, stress pa rin tayo. Pag hindi na tayo stress, ibig sabihin patay na tayo nun. So kailangan lang natin reduction of the stress, ililimit yung stress. So meron kang mga extracurricular activities wherein you can divert your stressful events or moments na katulad ng meditation as what I've discussed before sa or previous weeks natin sa wellness webinar, you can use also that meditation. And then third one is eat healthy food. Of course, nowadays, napapansin natin, instant. So, nagiging instant na din yung buhay natin. So, right now, we have to go back at the basic. So, kailangan nating sundin yung food pyramid. So, ayan, merong mga veggies, meron din tayong mga meat. Now, merong mga tips for fertility-friendly eating tips for Polycystic Ovarian Syndrome. So, kailangan talaga meron tayong variety of food. So, eat a bigger breakfast and a smaller dinner. Kasi nga, kung kailan tayo matutulog, minsan yung iba sa atin, pag pagod sa work, kung kailan natutulog, doon tayo kumakain ng marami. So, baliktarin natin. So, breakfast, gawin nating marami yung kain natin kasi yung breakfast, it will really help us boost our energy para hindi tayo magiging drain at the end of the day. So yung dinner, yun yung time na magre-rest naman na tayo, so we can have a small dinner lang. And then of course, we have to include more protein and greeny vegetables, so more on greens tayo. And then kung kakain tayo ng mga carbohydrates, kailangan complex. So meron tayong kamote, meron tayong bread, merong banana, may cauliflower, may quinoa, more on ang quinoa kasi carbohydrates din kasi yon. And then of course, if you eat sweets or a high carb foods, combine mo siya ng healthy fats. So healthy fats is avocado, yung mga hindi siya processed foods. Kumbaga pa makikita naman natin yan sa label ng food or yung nutrition facts. Makikita natin doon kung ilan yung percent ng good cholesterol or yung saturated or unsaturated fats. Makikita natin doon sa nutritional facts. So, treating infertility when you have PCOS. So, meron pa ring medication or treatment when it comes to PCOS. So, of course, this treatment will be consulted with your OB-GYN. So, kailangan talagang magpaalaga ka ng OB/GYN or any expert when it comes to having PCOS. Ang iba kasi nagpapa-consult sila ng internist or endocrinologist kasi may yung PCOS kasi mayroong insulin resistance. So, nag-entails yun or it will also manage the glucose level. So, for the medication to induce ovulation, so of course, we do have letrozole, human chorionic gonadotropin. So, mga ano yan, mga medication wherein it will help your body to ovulate. Kasi nga si PCOS, hindi ka makapag-ovulate. Now, for the fertility treatment option, so meron tayong timed intercourse. So, meron kayong specific time or schedule na pwede kayong mag-intercourse with your partner. So, it involves also monitoring, tedious yung monitoring niya. Kasi merong ultrasound, merong blood work, wherein magbibilang kayo kung kailan talaga dapat yung ovulation mo. And then yung doctor, mag-i-instruct siya kung kailan kayo pwedeng mag-intercourse during the optimal time of conception. So, ibig sabihin, meron specific time na katulad sa 28-day cycle. So, 14 days yung release ng egg cell natin. So, pag may ano tayo, pag during conception, of course, meron specific 2 days before or 2 days after, pwede kayong mag-intercourse doon ng partner mo. Pero pag hindi naman, hindi ka normal, so may PCOS ka, of course, kailangan talagang masinsinan or merong management ng doctor. And then intrauterine insemination, the sperm is inserted directly into your uterus through a catheter during ovulation. So medyo kamahalan yan, and as far as I know, hindi pa ata ginagawa to dito sa Pilipinas. So could be sa ibang bansa pwede siyang gawin. And then, in vitro fertilization, this cycle begins by stimulating your ovaries with medications. The eggs are then retrieved and fertilized in a lab where they will develop into embryos, and embryo will then be transferred into your uterus. So, para siyang artificial insemination. So, may mga cases ang alam ko meron dito, pero I am not just too familiar with the hospital that is handling this. So, ang alam ko meron ng in vitro fertilization. So, of course, lahat ng options nito, you have to coordinate with your OB/GYN or with your doctor. So, what are the medication for PCOS? Medication for PCOS, hormonal birth control. So, meron tayong ginagamit na tawag nito, may mga brands, mga Dayan, may mga something. So before you take that medication, you have to consult talaga your OB kasi merong iba hindi hiyang sa ganun na brand, may iba nag-high blood, yung iba dyan naman is nag-allergy. So that's why you really have to consult you really need to consult your doctor. Now, hirsutism medication or anti-androgen medication. So meron tayong medication na combined din siya ng acne. So, depende sa severity ng hirsutism natin at siya ng acne. So, meron specific dosage niyan kung ano yung dapat ireseta ni doctor. And then metformin, this is for the diabetes. So, of course, kung diabetes, ito yung nagre-regulate ng blood glucose natin. So, pag mataas kasi yung blood glucose natin, of course, there's a tendency that we will have a difficulty of conceiving. And so, do you have any questions or clarifications? We're open for questions now.
Hi, nurse.
Hi.
Yes, ako po, diagnosed ako with PCOS before mga 2017. And I took, ano yun, yung medication kanina, hormonal pills, which is yung Athena ba yun? Althea.
That's birth
Yeah.
control. Para siyang ano.
And then, nare-regulate naman niya. So, yun lang. Share ko lang po.
Yeah, kasi yun yung parang first line of treatment kasi ng mga doctors
Yes po.
pag nag-stop yung menstruation natin. So yung mga girls, ang nangyayari is pag nag-miss na tayo ng 1 month, 2 months, 3 months, tapos napapansin natin saka tayo nadadatnan. So we have to consult na talaga sa OB. Kasi minsan, merong tinatawag na, may tinatawag tayo dyan eh, pag sobrang stress ka, minsan hindi ka dinadatnan, ng isang buwan, minsan nade-delay ka din. So, ganun pa lang, yung routine or yung cycle na menstruation mo, ano na siya, hindi na talaga siya normal. Hindi ibig sabihin na monthly ka dinadat na normal yon. Kailangan within the cycle or nandun pa rin sa cycle. Sometimes yung 28 days, pwede siyang mag-extend hanggang 30 to 35 days. Pero 35 days, medyo matagal na yun eh. Parang 28 to 32 days, tolerable pa yon. Pero more than that, dalawa lang yung reason yun or dalawa lang yung result. Either buntis ka or either may PCOS ka. Dalawa lang talaga. So
Thank you,
any,
nurse. Ako, I have a question.
okay.
Kasi ako naman before, same with Trisha, pero wala akong yung diagnosis talaga from OB.
Mm-mm.
Pero
Oo.
meron ako lahat ng symptoms. Now, ang nangyari, after kong manganak, nawala na siya. Kumbaga, nag-normalize na lahat. Ganun ba
Okay.
talaga siya?
Actually, yes. Kasi nga, ang mostly or ang last na, kumbaga pa, meron kasing ginagawa si doc. So, pag nagre-reseta ng birth control, may mga medication, and then, pag nalaman niya na may partner ka, much better, ang ina-advise niya talaga, magbuntis. Why? Kasi pag nagbuntis yung babae, yung hormones kasi natin, nagno-normalize or kumbaga pa parang nagba-balance siya kasi merong baby na na kino-conceive. And yung baby kasi natin, kailangan din yan ng hormones. So yung ibang hormones natin napupunta during the conception. So there are times talaga na kung napapansin ng iba dyan, yung ibang mga mothers, before sila nabubuntis, grabe yung dysmenorrhea, grabe sila magsuka, pero pag nagbuntis sila or after nilang manak, nawawala yon. It's because of the hormones na na-release ng katawan natin. Kasi pag yung hormones din natin na hindi siya na-release, nagiging toxic din siya sa atin. Kasi 'di ba pag sobra, hindi siya maganda. So yung effect naman sa hindi nagbuntis, so let's say, yung sobrang busy sa life, meron tayong tinatawag dyan eh, career woman ang tawag ko sa kanila. Ang effect naman noon, pag hindi sila nagbuntis, hindi sila conceive, ano naman, ang effect nun is magkakaroon sila ng ovarian cyst, magkakaroon na sila ng mga myoma, merong mga breast cancer, may mga breast cysts. It's because of the hormones na hindi siya nailabas. Lalo na pag irregular yung menstruation, so nandun lang siya sa loob ng katawan. Unlike kung pregnant ka, siyempre yung baby mo, kailangan ng hormones yun. So, tayo ang nagbibigay ng hormones sa baby natin. So, that's why, pag natapos na tayo or after nagbuntis, nagiging normalize siya kasi nalabas na natin at nabigay natin sa anak natin yung mga hormones na dapat ilabas. Pansin mo nga, Miss Mara, di ba, before, nandun lahat ng symptoms, pero after ka nagbuntis, nawala siya lahat. And as far as I can remember, naka-experience ka ng gestational
Yes.
diabetes, right?
Saka
So,
mataas
high
din yung
risk.
BP ko. Mm-mm.
Yes. So, yun yung complication naman if you have PCOS. So, meron tayong testimony from Hara na ganun yung effect sa katawan natin. So, any further clarification, questions?
Clear naman na, nurse. Thank you.
I think we're all good. So, thank you for your time, guys. So, see you on the next wellness webinar and have a great day. Goodbye.